I had a patient who came in. She was around years old and she had a long history of chronic illnesses. So they didn't really know what was going on, but there was sepsis protocol in place. So I inserted 2 IVs and I was talking to the patient and assessing the patient while my preceptor was still getting a report from fire. And I was talking to this patient. She said that she had really bad back pain. So I assessed her pain levels using PQRSTU. And then I went to further my assessment. I noticed that one of her legs was really warm and swollen and hot to the touch. And then I was like, "Oh, are you experiencing any leg pain?" And she was like, "Yeah, actually, I am experiencing some leg pain." And this was like a ding, 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 like this isn't good. Like she might have possibly have a DVT, and if this like led to PE, she would be experiencing back pain. So this wasn't noted in the report that my preceptor did get. So I informed my preceptor of this, and then we both went to the doctor station, and this was a really busy day on the unit, so it would have taken a while for the doctors to make rounds, especially because the sepsis protocol for this patient, it was just waiting to get all of her labs. So this is something that was very critical because if I waited, it could have caused further exacerbation if it was a DVT or a PE. So I gave the doctor an S bar, let him know what was happening, and I asked him if he wanted to order any tests. Like I'm pretty sure it's an ultrasound that you do to diagnose a DVT or something,
Yeah,
right?
yeah, yeah.
So I asked him if he wanted to do an ultrasound or anything, and the doctor immediately went with me to bedside to assess the patient. And he ended up ordering the ultrasound, and he thanked me for coming straight up to him and not waiting and delaying the care because this could have been a potentially hazardous issue that could have put the patient at harm. So something I learned from this is to always speak up if I do notice something. And even though I was in a place where I was not a like I don't know if I can say that. I wasn't like a real nurse yet.
Oh, you say even though I was only a student nurse at the time.
Yeah, even though I only was a student nurse at the time, I always know that's important to speak up when I do notice these things because even if I'm wrong, at least I know that like safety is a priority and that the patient was safe. Like
Yeah.
I don't really
Yeah,
know
at
any
least
time.
you escalated it.
Yeah.
Or at least you brought it to the attention of the doctors so that they could work it up
Yeah.
or rule it or so that they could rule it out.
Hmm.
Yeah. Okay, I like it. You don't even need me.
I'm just so nervous.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube. And just so you know, you should have, I would say for this to have 2 stories where you had a patient who had something going on that was critical that you escalated. Really common examples are like anything involving like sepsis, low blood sugar, stroke rule out, any kind of vital signs that weren't great, like a patient who was bleeding, a patient who fell, like anything where it was like, this isn't great. Let me like escalate this and like work this up, let the doctor know so that this doesn't become like a really serious thing.
So I did come up with 2 examples.
Oh,
One of them
beautiful.
was,
Because this is always
yeah,
the
one of
hardest part. Because people are like,
yeah,
I wasn't allowed to do any of those things in school. And I'm like, of course not, because the
yeah,
hospital doesn't want to get sued.
yeah. So one of them was recently, I work at an allergy clinic, so we do immunotherapy injections where we're injecting people with what they're allergic to. And one patient had just received his injection, and literally as soon as he walked into the waiting room, he came back to the shot station, and I noticed he was really flushed. He was teary-eyed and looked like he was getting some eye swelling, and he's like, I think I'm having a reaction. So I grabbed him and brought him to the treatment room. And on the way, I grabbed the vitals tree, and we have flags outside of the doors. So if there's a reaction, we have to open up all of the flags. So as I brought him into the room, I opened up all the flags and called my coworker to get the doctor. And she could tell, because I'm really quiet, that because I yelled for her to get the doctor, she knew like there was a reaction. So while she went and got the doctor, I had him sit down at the table and attach the blood pressure cuff to get that going. And while that was going, I took out the emergency medication kit we had in the room. And I was talking to him the whole time just to try to calm him down because I could tell he was getting really freaked out. His eye swelling was getting worse. So I drew up the 0.3 of epi, which is what we usually give for his age and size. But obviously I waited for the doctor to come in before I gave it because I can't just give it. So I got that ready. We usually give Zyrtec too. So I poured some Zyrtec into the cup, just anticipating the doctor's orders. And luckily, his vitals were all stable, but he also had hives all over, nasal congestion, like all of the typical symptoms of severe reaction to his shot. So as soon as the doctor came in and saw him, she was like, go ahead and give the epi 0.3. So I did that, gave him the Zyrtec because the doctor ordered that too. And then I stayed in the room with him for about an hour, just checking on him throughout that whole time. But if I needed something, I had my coworker go get it or would have someone stay with him. So there was always someone in the room with him. So we didn't leave him alone. So that really helped reassure him because he was obviously very anxious. He had been on shots for a while, and that was the first time it ever happened. So it was a big scare for him.
And if you see like they ask you, tell me about a time that you had like great teamwork, or like tell me about a time you advocated for a patient, or tell me about a time when you had to act quickly, or a time that you actions you took helped with the safety of a patient's care, like any opportunity, go for it.
Okay.
Yeah, because this story makes you look like you are ready to go. Yeah.
The other story I have was, I guess I maybe wouldn't say it, but it was when I was an LVN at the nursing facility. But I had a patient that kind of random, but it's part of the story. He also had a history of hemorrhoids, but I hadn't known him to really have any of those problems in the few months that I had him as a patient. And when I came on to shift, the nurse that worked the knock shift told me that he had some bleeding from his hemorrhoids, and she said she put cream on it like the doctor ordered. So I was like, okay. I was just thinking that's kind of weird because it's not like very typical of him. And I know he hadn't had like any like episodes of like diarrhea or, anything like that. So I asked the CNA if she was busy and if she could change his brief first, and I would go in there and take a look. So she went over there and she called me in there, and there was blood in his brief. And it was like a lot of blood. So I helped her clean him up, and we noticed that he had like a steady trickle of blood coming out of his rectum. So I had her go grab the vitals tree and to grab the charge nurse too, because I was like, I think we're going to have to send him out. So she started checking. She put the blood pressure on as I was still continuing to clean, and his blood pressure was lower than usual, and he hadn't had any of his medications yet. And he also had like an increased pulse. I think it was like greater than 100. He was like really confused. So we're like, oh, we need to send him out. So she called the doctor to get the order because we don't have standing orders just to send people out. So we got the order. I had the CNA stay in there with him because she didn't know how to print like records out. So I gathered up all of the needed documentation. And then within about like 10 or 15 minutes, the ambulance came and picked him up. So I just made sure to call his son too, just to let him know that his dad was going to be at the hospital. But yeah, we recognized right away there's something wrong.
The story that comes to mind for that, I don't think is great because it was a critical situation, but it was at the camp, and so it wasn't like it was it was basically
You
like
didn't have your resources, huh?
one of the staff members like went into anaphylaxis, but he didn't know he was allergic to bees. And that's what he went into anaphylaxis from, but he had an EpiPen because he was allergic to peanuts. But like, I don't really think it works for this.
I mean, it kind of does unless you have something that's going to be kind of more your normal workflow.
Right.
Just say you've had emergency situations as a school nurse and in Yosemite as a supervising nurse, and it can be hard when you don't have a lot of resources or support staff that is, like a rapid response nurse or something like that, that you kind of just have to take charge and stay calm and do what you can to coordinate with everyone what you need them to do and like direct them and have everything run smoothly. That you had a patient who didn't know that he was allergic to bees until he came into your office anaphylactic, didn't understand necessarily what was going on, and you knew that you recognized it as anaphylaxis. You knew from his history that he had an EpiPen because he was allergic to peanuts, and you had someone locate that, bring it, and were able to administer that, and you did whatever supportive things in the meantime, either it was like oxygen or I don't know, coffee or whatever, like similar thing in the meantime. I'm so used to the normal workflow. I don't know if you called an ambulance or
Yeah, we call it ambulance. But I'm like, I don't know if that's like good to say because it's like obviously if you're at the hospital, you're not calling an ambulance.
Yeah. What else did you do in the meantime? Or like what did they do? Like obviously you took vital signs, and you like, what did you notice, right? Did you hear stridor? Was his O2 sat down? Like was his blood pressure tanking? Like what did you see that you were like, this is anaphylaxis?
Well, he was like bright red and like quickly developed like hives all over his body, and then his throat was like closing up, and he was like starting to like not like he could still breathe, but he could like actively feel his throat starting to close up.
Yeah. I think
I also have another one that maybe would be better. It's still not clinical, but at the school we had a student who had a seizure in the middle of the hallway, and so she had told her teacher she wasn't really feeling good, but she come to find out she hadn't had a seizure since she was little, so it wasn't like she wasn't on any meds for it, and it wasn't even in her care plan or anything like that. So basically she just like told her teacher she wasn't feeling very good. She like went out into the hallway, and then she fell and started seizing. And so then our whole team of the administration came because it was passing period. And so security kept the kids away from her. And then, like, I directed someone to call 911 and then turned her to her side and all that.
And you noted like what time it started and what time it ended, like, and gave report when the ambulance showed up.
Yeah.
Yeah, I think either of those would work.
Okay.
Then you can talk about how, while it's been great to have the experience of being the one everyone turns to for answers in a medical emergency, and like getting experience with calmly directing people and assigning roles and that kind of thing, giving report to the paramedics, you're looking forward to having staff around you and like equipment around you to help and learn more about the inpatient emergency care. Like rapid response nurses, and have meds available that you can give, have a PRN IV Ativan that you can give, and that kind of thing, and be able to work with EEG, and I don't know, be able to start them on Keppra or whatever. You can kind of say that while it's been a great experience kind of being the Lone Ranger, you're very much excited to have teamwork in that kind of situation.
Yeah.
Yeah, but I know, I mean, it is a really special skill to be the one medical person and have everyone turn to you and be like, what do we do? And you have to stay calm and assign each person a role that makes sense for them. You know what I mean?
Yeah. Yeah.
Yeah.